Do you have questions about the gestational diabetes test? I can answer them for you. Hi, I'm Dr. Alex Sherling. I'm a board-certified OBGYN, and I get asked questions about the gestational diabetes test every single day in my practice, and I'm going to answer them here. What is the gestational diabetes test? It is a 1-hour test where you drink a solution full of glucose or sugar to see how your body responds. Hormones in your body affect your pancreas and therefore how you manage your blood sugar level during pregnancy. If you have gestational diabetes, you won't manage this well. That's what the gestational diabetes test is looking for. When do we do this test? This is a test that almost everybody takes during pregnancy between 24 and 28 weeks pregnant. How long does the test take? The screening test takes 1 hour. You come in, you drink the drink, and an hour later we test your blood to see what your blood sugars are. Do you need to fast for the test? Usually no. The 1-hour test is a screening test and you don't have to fast for it, but I do highly recommend avoiding a lot of sugar before or on your way to your appointment because this can affect how you process the sugar load that we give you. What happens if I fail the 1-hour test? Well, then you do have to fast and you have to do the 3-hour glucose tolerance test. We do 4 levels of your sugar during this test, 1 fasting, and then at each hour after you drink the load. What does the drink taste like? Well, it's sweet. It's kind of like a flat soda. I like to describe it as like a Fanta kind of that has no carbonation. A lot of people think the orange flavor is the best, but I don't like orange anything. So I did the lemon lime flavor and it was actually pretty good. What if I throw up during the test? Sometimes this does happen. Sometimes patients that don't have anything to eat or are particularly nauseated because of their pregnancy hormones will vomit during the procedure. And if this happens, often we'll either redo it with some nausea medicine on board, or you can talk about alternatives with your doctor. If I have gestational diabetes, does this mean I have diabetes forever? No. Most cases resolve after pregnancy, but if you do have gestational diabetes, you are going to be at increased risk for diabetes later in life. If I fail, does that mean I need insulin? No. Most patients manage their gestational diabetes with diet alone and can do very well in pregnancy. Can gestational diabetes hurt my baby? Yes, and this is why we screen all pregnant ladies, because we know that gestational diabetes that is uncontrolled can lead towards worse outcomes for babies and sometimes even for moms. We screen all women to be able to identify those that have gestational diabetes, help them control their diet and exercise in pregnancy, and can help you to have a healthier, safer pregnancy. What if I refuse the test? Well, like I tell all of my patients, this isn't jail. You get to decide what happens to and with your body. I get to make recommendations as your physician, and I recommend that all of my patients take this test because it's a simple test that can help with moms and babies' outcomes. But if you refuse it, I would recommend that you discuss this with your provider. If I have gestational diabetes with 1 pregnancy, am I always going to have gestational diabetes? Some women won't get it with subsequent pregnancies, but if you do have gestational diabetes with 1 pregnancy, you are more likely to get it with other pregnancies.